This is Pod Populi, podcast for the people. Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Kandice Kichler. Today, I have two riveting guests in the cosmetic surgery and the cosmetic surgery industry field. So with me today, I have Dr. Sean Satey. Say hi, Sean.
Hi, everybody.
And then I have Tom Gaynor. Say hi, Tom.
Hello, everyone.
So I'm going to tell you guys a little bit about these two amazing men, and then we're going to get into a conversation about plastic surgery, about the industry of aesthetics and what's new, what's happening, key opinion leaders, all the things. So without further ado, Dr. Sean Satey, he is a board-certified general and cosmetic surgeon specializing in advanced body contouring procedures, including Vaser lipo, BBLs, tummy tucks, and breast dogs. He also offers non-invasive facial treatments like injectables, PRP, skincare. He's a first-generation American raised in LA, and he earned his undergrad degree from UCLA before completing medical school at George Washington University in Washington, D.C. He trained in general surgery at UC Riverside and pursued an AACS, American Academy of Cosmetic Surgery, fellowship in San Diego. Dr. Satey is a recognized key opinion leader, or KOL, if you see that abbreviation on social media and you're like, what does that even mean? For Renuvion and Vaser, serving as one of 6 national surgical trainers for the company. He's actively involved in the California Academy of Cosmetic Surgery, which I'm attending your meeting this year, by the way. And he previously directed its annual symposium. Dr. Satey, or Sean, as I'm probably going to call him during this whole podcast, is committed to education, and he provides injectable training for surgeons as well as mid-level providers. And his practice, based in LA, has satellite locations in Lancaster and Huntington Beach. He also has a wellness component to his practice. So welcome, Sean, Dr. Satey.
Thank you so much for having me.
Now,
It's an honor.
of course. I'm so glad to have you here. And our connector of the dots here, the man behind this podcast, is Tom Gaynor. So he is a medical and pharmaceutical industry leader who works on professional relations and strategy. So with over 20 years of experience, but he doesn't look that old, in the medical and pharmaceutical industry, Tom Gaynor is a seasoned leader recognized for his dedication to exceptional client service and patient outcomes. So he, unfortunately, is in the Pittsburgh area, and he's a Pittsburgh native, but he's held multiple senior leadership roles through his career, earning numerous accolades, including several President's Club awards. And if you're in industry, you know that that's a huge deal. So Tom is passionate about fostering strong relationships with KOLs and his organization, ensuring seamless collaboration and strategic alignment. His expertise in professional relations and strategy allows him to elevate the industry standard, delivering a white glove service experience while emphasizing the best clinical results for patients. So welcome, Tom.
Thank you. Welcome. And yes, we're all in the aesthetics industry, hopefully to stay young, right?
Absolutely. We all, if you're watching this on YouTube, we're all probably like 15 years older than you think we are.
For sure. For
Yeah.
sure.
Yeah. We got to keep each other looking good.
That's right.
Okay, so I've got a couple questions. I'm going to start with some of the basics, and then I know this conversation is just going to take off. But Sean, because I'm in the same field and I feel like what we do is very interesting to people. Your journey in medicine started in LA, took you across the country for training. But what inspired you to pursue cosmetic surgery, and how has your background kind of shaped that?
That's a great question. So for me specifically, first time I actually moved away from home from LA was for med school. So I'd never seen snow before. I'd never even moved out of the house. I'd never even touched laundry before, let alone anything. So went out to Washington, D.C. for those 4 years and had the time of my life. And then when I went back to Riverside, came back to California for general surgery, I was dead set on doing vascular surgery or colorectal and did tons and tons of research on it, specifically robotic surgery, mechanisms of actions of how these things work. And then it wasn't until my third year where a light bulb went off. And I'm like, I had a rotation in plastic surgery, and I'm like, you know what? I love this industry and I love this field because you're taking the tenets of general surgery, but now you're applying it to the realm of cosmetics. So you're really helping patients become their best version and becoming version 2.0 and having a complete new lease on life. And so that kind of allowed me to, progress my career and go into cosmetic surgery and become who I am today.
I love that. I mean, obviously, I have a similar background in general surgery. I actually started practicing in bariatrics and robotic surgery. Like, I did all the things. And then I made the switch when I felt like, I really wanted to finish the job. I helped people lose
Exactly.
weight. And then I wanted to do their tummy tucks, do their skin removal, all the things.
It's so rewarding to be able to do that because your patients now truly they become family, and I'm sure you can attest to this also, but you're with them at some of their most vulnerable periods of their lives, and they come to you with concerns, and you're able to definitively address that and be a part of that journey with them over the course of the year. And then, at your day 365 where they graduate from your service and graduate from your clinic, it's such a liberating feeling to know that you have been that impactful. So it's amazing. I'm sure you can, comment on that as well.
Absolutely. I love it. I often say that my patients become my friends
Mhm.
because I do. Like, I get to know them. They have my cell phone. We text, we DM, and it's like I really like build this relationship that I think is unique and not many other surgeons get to experience that.
I would wholeheartedly agree. And just like you, I think across the board, I would say every single one of my patients have my cell phone number as well. And I know every detail of my patients' lives. I'm talking about the name
Mhm.
of their pets, significant others, the life
Mhm.
events where they're traveling, and they know mine as well. And so you're saying patients become friends. I say patients become family. And so I think there's no better feeling in the world than having that bond with your patient.
I agree. And likewise, the people that I work with in industry also become my friends. So that's where people like Tom step in. And it's like,
Exactly.
I know we're talking business, but at the same time, like, yo, what's up with your family? What are you doing this weekend? All of the personal things kind of get in the mix.
Totally. It's even the conferences that come up. It's like, hey, Tom, what's going on afterwards? We're going to go out to this conference, but are we going to hang out afterwards? Or somebody else? Are we going to do something with the colleagues, doctors, friends, nurses? So, these conferences actually become the best, forums for us to all get together and see the extensions of our friends as well. And I wholeheartedly agree.
I agree. So, Tom, shifting over to you and your side of the table, I mean, you're known for delivering this like white glove service. You prioritize patient outcomes by, giving us the tools to make the best results possible. But in your experience, what separates a good provider from somebody who's truly exceptional? Oh, no, you're muted.
Well, thank you. First of all, great question. Thank you for having me. It's a really good question, right? So, I think from what I've experienced and what I've seen in those best practices, it's someone who not only has obviously a clinical acumen, high level, thinking patient centric, but there's also a business acumen component of it, right? Everybody has either a practice, multi practices, or social media. They're thinking from a business lens standpoint, what's the new ROI? How do I make my office or practice more robust? And then there's the social media, social influencer component as well to that, having that acumen. So I think the practitioners that I've seen not only collaborate best with industry, but also evolve in their own growth, have all three of those built right in.
I agree. I mean, I think you've got to do everything these days. You can't just be a good doctor.
Can't. Yeah.
You've got to do the social media, you've got to be smart, you've got to be talented, you've got to have good outcomes, but you've got to be personable as well.
Yeah, and in all those aspects too, it's part of Dr. Satey had mentioned, it's the networking component of it as well. If you're not going to conferences, if you're not going to continuing education opportunities, if you're not leaning into the organizations that are hoping to educate you a little bit further on, implementing something within their portfolio, you might be missing out as well too. And how we connected where we did, and looped in Dr. Satey. You just see how things evolve. I mean, this is probably what, less than 5 weeks from when we all connected to now where we're at today.
Yeah, exactly. And I feel like, I'm gonna go on like a slight tangent here, but I feel like these components, these aspects of a really good, successful surgeon and leader in the industry is really hard to come by. And it's getting less and less frequent. Like, I think the harder it is to get into medical school, like, the harder to get into these certain subspecialties, like, the more disconnected the providers become from the patients because they're robots.
Right. You lose that personal touch. Even for us, when we went to school, when we went to residency, considering all the stuff that we've learned from then till now, it's a complete different world. And, if you don't continue to advance and you don't continue to learn, you fall behind. And, specifically, with the advancements every single day and the technologies that are constantly coming out. And, I totally agree with you as well that more and more nowadays, I have medical students that rotate with me as well. So I see kind of the new generation coming in as well. And you'll see some of the students that are far standouts, but then you'll see other students that are just like robots. And it's just, you're finding the smartest of the bunch, but you really lose that personal touch. And I couldn't agree with you. It's more.
It's crazy.
It's wild.
Are you finding that in, like, the industry side too, Tom? Like, your candidates are just changing, or are you getting good apples?
I would say we haven't had any bad interactions. I would say that from an industry standpoint, we have, and this gets into the greater component of where you guys fit in, international, national sphere of influence, maybe local, more regional sphere of influence. And then we have maybe more of the focus of the research clinical trial. But, a lot of the industry right now, and has been focused on those residency fellowship programs to find out the new up and comers, like Sean was mentioning, just finding some of those green apples out of the bunch, I guess you could say. So I always enjoy, from my position, my job in my past roles and current roles are to help educate, coach, prep. There is a component, a human component of, even going a little bit further, when someone's, ready to take podium or be on a webinar of, have fun with it, enjoy it. I think sometimes, we look at it from a lens of like, well, we don't want to step in there and help coach, but I always have fun with it, enjoy, give them a little bit more of understanding of, hey, here's when to pause, here's when to hold on a second, or hey, this is the slide that I really want you to take away from my presentation. If you take anything away, and I've just seen from some of my interactions, uh, practitioners, they enjoy that, they encourage that once it's been presented to them.
No, I agree. Those tips are super helpful. Even doing this podcast, like, from when I started to now, I'll say "like" too often, I'll do weird pauses, and it's like, if I haven't podcasted in a couple weeks or months, I catch myself doing all the bad things again. So having a coach or a mentor or someone who can give you feedback is so important. So it kind of permeates all areas, not just on the podium, but also in real life.
Yeah, and I think that the most important aspect of what I can do is when we have, yeah, we call it new talent or an up and comer. I've had some most recent interactions with that where you can see it, like you can actually see the vision that this is someone we want on podium, that they're going places. And for me, I kind of like feel like that's a characteristic trait that I own myself. But being able to have someone do their first presentation, and the whole entire company and the recipients are acknowledging, wow, this was great. Like we need to work with this person a lot more. Just in my own past year, Sean and I have gotten a little bit closer in terms of like understanding his growth and the opportunities that the organizations that I work for are able to help and support him. And I can't tell you enough about Dr. Satay's responses from not only the recipients of some of his talks and his presentations he's done, but also just the organization's feedback of how valuable he is and what he brings to the table, and they want to continue to work with him. So, my job, if I'm doing it right, it's putting the right person on podium, it's highlighting the right, clinical background, as well as just making sure the audience receives what they need to receive from the presentation.
I love that. So, going into that part of the conversation, Sean, Dr. Satay, you're one of only 6 national surgical trainers for Vaser. I'm familiar with Vaser. I don't currently use it, but I
Yeah,
know it's
I'll change
great,
that.
and a lot of surgeons do. I know you're like, "You're gonna change that. You're gonna buy one tomorrow." Um, but what does your role entail? Because I think it's interesting, all of my not all of my listeners are in medicine necessarily, but they follow, plastic surgeons, cosmetic surgeons, dermatologists on social media, and they see these people who are speaking. When you're speaking, you're a KOL or you're a leader for an industry, what does that entail and what makes a good surgeon for that role?
Great question. So, specifically for those that don't know what Vaser even is, so Vaser is a tool that we use to help us with our liposuction cases. So, in my practice, every single liposuction case is a Vaser assisted liposuction. So, in reality, what it does is it's a tool that allows you to get more fat out in a safe and effective manner without damaging the skin. It selectively targets the fat, not the arteries, nerves, or vessels. So, recovery time is a lot less. And then, if we're transferring fat, for example, to the buttocks or other areas like a BBL, your fat has a higher chance of survival. And I've adopted this technology early on since the inception of my career. And, I've been honored to be asked to be one of the KOLs or key opinion leaders. So I speak on behalf of the company, kind of showcasing my experience with it. We've done thousands of procedures over the years. Not only that, I'm actually one of 6 surgical trainers. So if a surgeon purchases one of these devices, the company actually gives the opportunity of those doctors to come to me for them to get trained by me. So it's a huge honor and it's a huge privilege. And the things that I like to teach people is really understanding the underlying anatomy, understanding what patients can benefit from this technology or this tool, and which patients aren't the best candidate for. For example, someone's a candidate for a skin excision or having skin removal. Understanding what's safe and what's not, and who's the right patient and who's not. I think that's a huge, huge part of what I do.
I love that. I mean, you kind of played your role right away explaining what exactly Vaser is. That's super helpful. And for someone like me, I already know what Vaser is, but now my entire audience knows what Vaser is and they're going to be asking me for it. So here we go. Sale made.
Honestly, the best thing that I can say is, when it comes down to liposculpting, Vaser is the Birkin bag, or Vaser is the Rolls Royce, the Ferrari of liposuction. And so, if I wouldn't have it any other way, if it was my sister, my brother, my dad, or my mom that won surgery, I would offer Vaser liposuction. In my hands, I would get the best results. And so when you think of it in that nature, and you really kind of get the experience behind it, because there's a learning curve, you can't just pick up the device and just go at it because you'll burn a patient or you'll create, problems. But once you have the right tools set out by the person who's training you to know the safeguards, to know the limitations, to know when you can push things to the limit, the opportunities and the outcomes that you're able to achieve are endless. The muscle definition, the fat extraction, just as a whole, just kind of gets blown out of the water.
I love that. We could talk about body contouring all day. It's like my
I can talk about
favorite
these
thing.
all day. So,
Amazing. So, Tom, you've worked closely with KOLs. What role do you think the KOLs play in like advancing the medical and aesthetic treatments and how do you like help them to do that?
Well, I think there's been like an evolution within the medical pharma space for many years. I don't know how far back it relates, but they've adopted significant roles like medical science liaisons across the board, right? It used to be maybe only one segment of the industry true pharma, but the medical and pharmaceutical spaces have now evolved into this professional affairs, professional relations, or I guess thought leader liaison roles. And what the KOLs bring to the table is these key opinion leaders, there needs to be a vehicle between the organization and the industry, right? Someone who can have those conversations outside of a sales conversation, right? Finding an opportunity or an event, whether it's, like within your spaces, society meetings, conferences, and opportunities. But I think what the key opinion leaders for the organizations as well as their own spaces, right? The medical space, they're offering opportunities for students, fellows, even their own peers to hear, like Dr. Satey just mentioned about what platform he's using, what type of device he's using or technique. Even with you, Candace, in some of your own procedures and techniques, like people come to you guys for that best practice, for that education. It might be a space, and I always look at it like this, like there's a lot of acronyms after some people's names, but they're still human beings. And there's some fear, there's some hesitation, there's some uncertainty about doing certain aspects of your profession. And you go to your peers who you trust and believe in. And I think that the key opinion leaders, again, that can be international or national, like I said, local, regional, but they offer that elevated education, the acumen that maybe they want to learn and respect from somebody out in their space. So I think there's many different ways and experiences that I've seen, but a lot of that happens at conferences when KOLs are on podium. They're chosen for a specific reason because of their sphere of influence. There's also workshops and true, I guess back in the day, pharmaceutical dinner programs, but you're going there for a reason because that's your peer, but you also respect the space that they're currently in. They're looked at as a thought leader.
I'll tell you one of the beauties as a KOL leader is that, you truly are able to be a resource for those that are adopting the technology that, for example, don't have as much knowledge behind it or experience behind it. So, for example, Candice, let's say tomorrow you decide that you want to get a Vaser device. I would be a resource to you to help you in any way that I possibly can. And whether it's through, going to, let's say, for example, the California Academy of Cosmetic Surgery conference that we were talking about and hearing a podium speech from me, or going to a cadaver lab where you get to have a hands-on training, for example, or just being able to pick up the phone and reach out and give us a call and, having that layer of support that, hey, I'm about to do this case. I have X, Y, and Z going on. What are your thoughts? And it's creating a network of, of foundational support that you can reach out to whenever you need it, and that ultimately translates to the best outcomes for you and your patients.
Yeah, and also to dovetail off that, when the organization is looking to maybe expand an indication, there's an area of development, the skin of color, locations that they're trying to get further evolved in and advanced in. You're looking to those key opinion leaders. No disrespect to any other practitioner, but you need someone who's knows the space, is connected, understands it, been doing it for a very long time. So I think, to emulate what Dr. Satay said was they're looked at for specific reasons, and it comes from the peer to peer, it comes from industry, it comes from the community, right? Like people go on people's platforms to listen because they're just interested in medicine. So I think it's a unique opportunity that you all have to influence, and there's many different types of influencing that you're doing. So I just love partnering with key opinion leaders. I love what you guys bring to the table, and like the organizations enjoy, collaborating and partnering with you all too.
I totally agree. I think networking, collaboration with our own colleagues and the industries that we work with is paramount. If you have a provider who never goes to conferences, doesn't have any friends within their field, is really just sticking to what they learned right out of training and hasn't advanced, that's like a red flag for me.
You'll become obsolete if you just do that, because what, let's say 5 years ago, I was a completely different surgeon than I am today. And because of how much advancements that I've made, because there's so much new technologies that are coming out, there's so many different avenues of aftercare that you can now help your patients with. And ultimately it comes out to getting better results and just kind of picking and choosing the little details from other surgeons that you like and adopting that into your practice. And I always say that, the smart surgeon is the one that learns from other people's mistakes. So one of my favorite things that I love from going to these conferences and going back to M&M when we used to have it for general surgery, the mortality and morbidity meetings is you
PTSD.
right? You get to learn a lot about, this is what I did and what was wrong, and you learn from that. So you make sure that you're not gonna do that for your patients, and you're gonna get even better outcomes for yours. So I think that that's really, really important.
100%. So, kind of along those lines, this is a question for both of you guys. In the competitive industry that we're in, what strategies have you found most effective for maintaining strong client relationships and standing out in the market? I mean, you're in LA, like it couldn't get any more competitive,
You know,
So,
in
what are y'all's thoughts about this?
our own building, I would say there's probably 20 other cosmetic and plastic surgeons alone, and I'm just talking about our one standalone building. I'm not talking about across the street or anywhere else.
Right.
I always get super jealous when I'm training one of the surgeons that they're like the only surgeon in like 50 square miles. And so they're like, oh, all the business comes to us. But, I actually like that because when patients come to me, they're truly coming to me and they're coming to me for my results and they're coming to me for my white glove service. They're coming to me for my safety. They're coming to me that they're joining my surgical family. And like we mentioned before, everybody gets my cell phone number. Everyone has direct access to me. That's 24 hours a day, 7 days a week, not only to me, but to my team as well. And then when you couple that with, phenomenal results and a breathtaking surgical center and a team that will go above and beyond for anything that you need, truly a white glove service, patients love that and they value that. And that's why they choose to come to us. Now, what I bring to the table, on the other hand, is I always challenge myself. Every case that I do, at the end of it, is I sit there and I'm the hardest critic ever on myself. And if you talk to my team, any case that I finish, I walk out and I ask everybody in there, what could I have done differently? What could we have done better? And they'll always look at me like, Doc, why are you so hard on yourself? This was a home run. And I'm like, because I could be better, because I could do something that's going to be better for the next patient. And I think it's that strive and that hunger to always be better and take your results to the next level and to always be ahead of the curve and bring on newer, safer technologies to assist with that. So that's what I promise my patients, and they come to us loving that.
Yeah,
I am
it's a
so
great
similar.
Yeah, you have to
yeah.
be, and
Yeah.
it's one of those things that if you really don't, like you were mentioning, if you're not constantly evolving, if you're not constantly getting better, everybody for the most part, not everybody, but most people will get good results. And
Yeah.
most people are personable. But when you couple everything together and then now you also are adding in all the bells and whistles and the cutting edge technology and, you know, everything that is, optimization and looking at their entire wellness and everything as a whole, you now are delivering your patient a really nice package that they don't have to go seek out other things. And it makes life a lot easier for the patients. And this is a very stressful period of time for a patient when they're coming to you for surgery, and having everything kind of aligned for them and managed for them. And sometimes our team will even help patients kind of coordinate their travels if they're coming from out of the country or if they're coming from a different state. Sometimes we're helping them coordinate some of their, private jet or flights and things like that to make sure that they're going to get here and have everything ready for them. We also have alliances with, most of the major hotels in our area in Beverly Hills, from the Mayborn to the Four Seasons. So everything is taken care of, and that's what makes life easy for your patients. It's not just the surgery; it's the recovery as well.
I
Yeah.
totally agree. Tom, what were you gonna say?
I was gonna say that those are great points, right? Because the community talks and patients have
Mhm.
forums as well, and also amongst your peers. If you're delivering that type of service and the patient experience and the good outcomes, not only does your community talk, but the patients out in the spaces talk as well too. They have platforms now as well. So I couldn't agree more with Dr. Sate. And I would say from a industry standpoint, in terms of strategy and maintaining those relationships. I've had the privilege of progressing through my sales career and kind of moving up within the organizations to, be a part of, the thought leader liaison team where we're the connector, we're the vehicle between practitioners and our organizations, as well as, industry leaders and conferences, back toward our companies as well. But, for me, we're developing speaker bureaus, right? We're setting contracts in place. We're prepping and training and educating doctors in peer-to-peer training or getting them ready for an event that we have. For me, I feel like it's a customer service aspect, right, of what I do. I'm not tied to any sales metrics. I don't play any components in sales, but it's what their experience is with not only me as me being the face of the organization to them, but their experience within the process, right? The follow-up times, the punctuality, getting them expectations for the event, even getting them prepped and trained for it. I think that I've garnered really good relationships throughout my career. I always pride myself on my phone has probably about, I don't know, 1,000 practitioners throughout my phone that I can just pull up, and they're either current or past experiences, and they'll answer me and text me. But Dr. Satey could probably add some light on this, but it's all how they've experienced the interaction with you, but also how they look at the organization from that standpoint.
Totally. I'm sure, Candice, you can relate to this as well. But, if you treat your patients right, if you're your patient's best advocate, and that, I pride myself with not upselling my patients. Oftentimes, or too often, my patients will come in wanting something, and it's to my advantage to just do it. That's how we make money.
Mhm.
But I'll actually talk them out of it because it's not the right thing for them. And once you lay that solid foundation, even if they don't do the procedure with you and they walk out of here, they walk out of here empowered and trusting you. And I think that's the biggest thing that, as a provider, you can provide your patient. And then when they leave, in turn, they will bring you two or three other patients that now trust you as well. And building that network just allows you to grow little by little. And we all know, patient referrals are by far the biggest blessing and gift. So I couldn't agree with you more, Tom.
Yeah, and the other component of what I do, versus what you guys do is your experience fun? Is it interactive? Is it all robotic or rigid or like, both of you, I had different types of conversations, but it got to like a human level, like, what are you doing next? How are you traveling? How's your family? Things of that nature. And people want to work with people they like and they gravitate more towards that and also, having a fun aspect of it too, enjoying the time that you spend. No one wants to spend time with me if I'm boring and dry and, not not fun and interactive. But, I just think that's part of my strategy as well. I mean, um, I've learned throughout this, career that I've had that, the way I present myself, it comes back tenfold. So people wanna enjoy and hang out with me, they're always looking for me, I'm searching for them, and it all kinds of works out.
Yeah, I totally agree. I share a lot about my personal life through this podcast or on social media. And there have been times where I've pulled back because either I felt like I was giving too much or it was cringy or whatever the reason. Maybe the practice I was with, they didn't love everything I was saying. And I've always regretted that. Like people want to know the real you, whether you're working with them as a colleague or whether you're their doctor or any relationship, they want to know the real you. And it's so amazing to me how much people connect with that
Yeah.
and remember, even just today, I was doing a laser on a girl and I was like, "Oh, how old are your kids?" And she's like, "They're close to your kids' age." Because she knew the ages of my kids because it's all over social media and it's just crazy because it already builds this bond before they even walk in the door. And it's not to be used in advantage to take advantage of someone and to upsell them and things like that as you were referring to, Sean, but it's more like building that trust,
Right.
keeping that trust going. Like, you know me, you know my family, you know what I'm like. I'm not going to tell you to do something unless I would do it myself or I think it's going to work.
Yeah.
Yeah, no, I completely agree. One thing I always tell my patients also is that a lot of the products and stuff that we even bring here, we try on ourselves first. So all my patients, like, it's like the best thing working for you because you get to try anything and everything. So, and I pride ourselves with that because if we bring something, for example, a new product, let's say Juvo instead of Botox, all of us are trying it first and we're going to validate that it works before I'm going to offer it to you. The same way that I would do something to myself first before I would do it to my mom. And so I think that
I wish
also,
I could lipo myself.
I knew you were gonna say that. How did I know you were gonna say that?
I really wish I could. Like there are spots. I'm gonna
That
come to California. Sean, you can take care of me.
you don't need it.
Okay, so looking ahead, this is kind of a broad question, but I'm interested to see your answers. What trends or innovations do you think will have the biggest impact on the aesthetic or wellness industries in the next 5 years?
Just a second, let you go.
That's a great question. I would say probably I feel like as time is progressing, we're entering more and more into the regenerative world. So I would say, already we have PRP, already we have exosomes that are coming out. There's that whole gray area with stem cells. And,
Mhm.
I just see that as time progresses, we have so much, tourism going outside of the country for this stuff that eventually this will all become on label FDA approved. And there's so many health benefits behind a lot of this stuff, specifically when it comes down to stem cells and exosomes, that I have a feeling that as time progresses, probably over the next 5, 7 years, this is going to be the new wave. Whether it's going to be for scar management, whether it's going to be for resurfacing of the face, regenerative properties, for injectables, for hair restoration. So I have a feeling that's probably how it's going to be going more and more towards as time progresses.
Yeah, I can definitely see that too. I mean, even, I'm in the somewhat crunchy woo-woo group too. Like I don't look like it, but I'm very organic and I love to follow natural medicine, functional medicine providers and what's going on in that field. And they're the ones that started all of this, like the
Yeah,
exosomes, the stem cells,
yeah,
like
all
because
of it.
it's natural, it's your
Mhm.
own, or it's, something that's innate in your body. You're not putting as many foreign substances. And that's what people want now.
Totally. We actually did a PRP earlier for a patient, where we did it for the tear trough area for dark circles and then again for the hair restoration. And I mean, you see a patient a couple weeks later and literally the dark circles under the eyes are almost gone. And it really shows you the regenerative properties of your own body. Now, imagine
Yes.
kind of progressing that to harvesting your own fat and then taking your own stem cells out of the fat and then injecting those. So there's so many layers to this that I feel like in the next few years, it's just gonna blow up.
Totally agree.
I definitely agree with that, and I see another component to that as well too. I think that for traditionally over your lifespans in your profession, you've seen an evolution in certain aspects, right? Injectables like Botox, were 20 years ago you weren't having 20-year-olds proactively come in, you were maybe had a segment and maybe it was pigeonholed, maybe it was the 35-year-old plus woman. Now it's you have, such an evolution, it's more proactive, right? I think that the whole industry itself, medical and pharmaceutical, is now becoming, instead of reactive in the United States, is becoming more proactive. We're starting to change those trends. Internationally, there's a lot of proactivity in different countries and cultures. The United States is usually, hey, I get to a certain age here, I get to a certain weight, I better start doing something instead of the proactiveness of that aspect. And I think the other point that I would like to make is I think that there's going to be some evolution and innovation in men's healthcare. You're getting a lot more men interested in these, or their wives or spouses, or like trying to get them to be more in the aesthetic arena. So you guys would see that more than me, but there's a lot of advances, a lot of movement in the woman's space, but I think the men is where the biggest change and innovation is going to be, because these procedures now, hair restoration, resurfacing, injectables, that's a whole other segment that's not really tapped into, I believe. I don't know how you
And I
guys.
think men to what you're saying, men are now more open to the idea of doing things. It used to be like, "Oh no, you do nothing. You get old, gray, salt and pepper for a while and wrinkled up and that's it." But social media, we all see, younger guys, dad bods are not really as cool of a thing anymore. I was at a baby shower recently and this woman had just gotten married, not the one with the baby shower, somebody else. And she was like, I just got married. My husband's much older than me, but I really gave him a glow up. And she said everyone from his family was asking her what he did. And she was like, oh, no big deal. 1 year of Ozempic, 2 hair transplants, and a round of Botox. And I'm like, It was very funny and it
That
was
is funny.
great, but you know what? The guy looked amazing, he felt amazing, he photographed well, and his family noticed it without noticing it, if you know
Right.
what I mean.
Yeah.
It wasn't like, "Oh my god, he had a horrible facelift."
Yeah, it's an untapped segment, and, there's definitely a need for it, and like you said, it's being more culturally accepted or even just in the space, more thought about. Sean, I'm sure you've seen that too and heard that.
I'll tell you, we embrace it at our practice. We call it daddy do-overs. So it's
Yeah.
mommy makeovers and daddy do-overs. And,
Mhm.
so it's one of those things that we have tons and tons of patients that come and we help them become their best version, in order to do a really or have a really good result in my eyes is to have a very natural result. So, everyone will look at you and feel like you look different. You look like a new version of yourself, but they can't really put a finger on what you did because it's, a little bit of this, a little bit of that, a little bit of this, and you just look like you're glowing and you're a newer version of yourself. And I think that's the biggest compliment to a surgeon, I would say, or to any practicing provider, because if someone walks in like, "Oh, look at that," th it kind of shies you away from, the beauty enhancements of things, the naturality of it. And going back to the first question of what other advancements, I think with the weight loss revolution that we have right now with, most patients on tirzepatide or semaglutides, you know, in the next 5 years, I do foresee a lot of procedures to address a lot of laxity in skin or technologies, for example, that will allow us to achieve skin tightening externally for patients that otherwise wouldn't have been a candidate for it and should have gone through surgery. So I think that's probably another thing that's going to come in throughout the times. If I had to put my finger on something,
It has to, for sure. We're demanding it.
we need it.
Yeah.
I agree, and I think, to kind of piggyback on what you guys were speaking about, like a full comprehensive transition or change in your appearance. It doesn't have to be dramatic, but one of the things to note when looking for a provider is to look for someone who is going to give you a full assessment, who
Mhm.
isn't just going to allow you to come in and say, I want Botox here. That's where I always get it. I don't want it anywhere else. But be able to provide you a full face assessment or, okay, you've lost weight. What are your options for the excess skin? You're a mom, you've breastfed, now your breast change. What can you do? What's in the toolbox? And having someone who's able to kind of tell you a range of options, not just one certain thing that they happen to be good at, I think is very, very important.
In my practice, we always talk about things, I'm sure you do this in yours as well, Candace, you know, this is the least invasive option. These are the limitations. This is the most invasive option, but this is a limitation. And then, we talk about the Goldilocks approach of this is what will probably get you the best of both worlds. And then depending what the wants and desires of our patients are, we'll customize and tailor, a specific regimen for them. For example, someone has laxity of their face, doesn't really want to have the surgical, scars of a facelift or isn't ready for a facelift yet. We'll talk a bit more about volume restoration, for example, with Sculptra or other modalities of tightening the skin with Morpheus 8 or, just kind of meeting them in the middle. But I think a lot of it, again, comes down to being honest, transparent, and really listening to your patient to have that holistic approach. And then sometimes your patients don't know what's the best for them. They've heard of something that someone's told them and it's the wrong thing. And it's not being afraid to tell your patient and explain to them why that may not be the best option. And, sometimes again, it's better to not do something than to just do something for the wrong reasons.
100%.
And I think that
I get
your
you in
earlier
trouble.
Yeah. I think, Candace, to your earlier question too about like what makes a key opinion leader or what is perceived or thought after is what Dr. Satey just mentioned that, and you did. You're taking a holistic approach to the patient's interaction, right? You're not just looking at one modality, maybe even looking in conjunction to use other modalities together. You're basically pioneering. You're giving the full assessment. You're giving the patient what you know is best for them, helping them, coaching them You know, a lot of people will come in now and tell you, I read this or I heard that or I need this or that. But like, it's really you guys are the subject matter experts. And if you're providing that expertise and what you know is best based on your experience, but that all comes with, going to, like I said, the conferences, getting the education, talking to your peers, listening. As Dr. Satey mentioned, if you're not doing those things, it's kind of archaic at this point. Like you got to be advancing and evolving because everything is evolving around you.
Exactly. I just, and if you don't also listen to your patients and maybe they bring you something you haven't heard of yet. I mean, it's possible with, things at the tip of our fingers, social media, TikTok, all these things. I'll have someone come in to me and tell me, "Oh, I heard about this." I'll look it up. I'm not gonna
Yep.
immediately shoot something down and say,
Mhm.
"Oh, no, no, that doesn't work. There's no way because I didn't learn about that in school." Like, that would be crazy. Of course, there are new things on the market. I
Mhm.
wanna learn about them just as much as the patient does, so I think that's kind of one of my, benefits is I'm also a consumer. But, also being humble as a physician. I know I don't know everything. Let's
Totally.
learn more, and let's see what we can do and what's gonna be a really good option for you.
Yeah. Agreed.
Okay, so this has been very informative, enlightening, I think educational for all of my guests and your guests. But are there any other topics or like closing thoughts that you guys want to give our audience? Pro tips, words of advice, anything like that?
As far as a pro tip, when you're selecting a surgeon, I think that's one of the most common things I get, is, find someone that truly understands you as a whole, is going to be safe, has the skill set, but most importantly, like you mentioned, Candace listens to you. I think oftentimes, where there's a disconnect between patients is, making sure that your surgeon can meet your expectations and having that honest discussion of this is what I'm looking for. Are you able to achieve this? And making sure that your surgeon's not going to overpromise you. I would say about 60% of the cases that I do are revisions. And those are, patients that have gone to other surgeons that are unhappy. And across the board, every single time, it's that I wanted X, but I got Y. And every time I ask why, it's because my surgeon promised me this. So finding someone that's going to be honest with you, I think is the most important. And the second thing is don't always go for the cheaper price. I think
Oh my
far too
gosh.
often I have patients of mine that are coming from Tijuana. A lot of my patients are coming from, for example, Miami, Florida. A lot of my patients coming from the Dominican Republic, and they're getting, these mommy makeover procedures that are, $4,500 for a breast lift, this
Crazy,
and that. And
crazy.
when I think about it, that doesn't even cover the hard costs of my OR and anesthesia. It doesn't even cover OR, let alone anesthesia, let alone the rest of everything else. So it just blows my mind that how they would even allow their body to go to something or a situation like this. And so the one thing that I would tell you is wait until you can do things right and do it once because it's a world of a difference going through tissues that are scar tissue that are revisions. And it costs 2 to 3 times more. And if there's anything that I can tell the listeners is, do the right thing and do it once. You will be very, very happy.
I completely agree. I mean, obviously, I'm here in South Florida, so I see
I'm
many
sure you see it.
patients,
I'm sure
yeah,
you see
who
it day in and day
same
out.
thing. It's like, "Oh, well, why is your mommy makeover this much? Like, I could go right down the street 2 hours and
Yeah.
pay 5,000 literally $5,000 for a mommy makeover," and you're just like, "It's
Yeah.
not the same."
Yeah.
Like,
They'll,
it's
they'll bring
probably not
quotes.
even a surgeon doing your
Totally.
procedure, by the way.
They'll bring quotes and, it has
Mhm.
it on there and it just blows my mind and I'm like, "This is impossible. This is just can't happen. This is just," and you find out that some of these surgeons are doing 6 cases in one day and, some of
Yes.
my cases take, 4, 5, 6 hours. And even if let's say 6 hours did